The World Health Organization has just released its brand new strategic plan for coronavirus disease threat management, and it reads less like public health guidance and more like the groundwork for a permanent pandemic-era control system dressed up as long-term preparedness. Let's dig in. The latest plan by the corporate and pharmaceutical upper echelon of the World Health Organization have just unveiled their latest strategic plan to make the COVID-19 emergency response permanent. This is being sold to the public under the guise of management of all coronavirus disease threats, from COVID-19 itself to Middle East respiratory syndrome called MERS, and any potential new coronavirus diseases that lurk under the banner of maybe Disease X, looking into the future pandemic crystal ball. They call it a turning point in the transition from the COVID-19 emergency response to sustained, long-term, and integrated management, building on the lessons of the past 5 years of COVID-19 response. So, here we go again. Another glossy, hyper-bureaucratic document from the World Health Organization, this time branded as the Strategic Plan for Coronavirus Disease Threat Management 2025 to 2030. On its face, it reads like the usual for your health jargon about integration, equity, and sustainability. But beneath that polished language, this is more about implementing the architecture of a permanent global surveillance system, conveniently justified under the banner of disease prevention. It's hard not to notice the timing. After years of pushing for a sweeping pandemic agreement, one that still hasn't materialized in the form of WHO Director General Tedros Ghebreyesus so desperately wanted, the WHO now presents this 5-year strategic blueprint, and suddenly every country is urged to align, to harmonize, and to build resilient systems that all seem to point in the same direction. Centralized data control and pipelines, cross-sector monitoring, and a surveillance web stretching from humans to animals to the environment. All, of course, in the name of preventing the next coronavirus crisis, a manufactured crisis, if you will. This new announcement reminds us all at length of SARS in 2002, MERS in 2012, and COVID-19 in 2019, which reminds me how much better off would Canada have fared if the early warning signal we all paid for, called the Global Public Health Intelligence Network, wasn't getting a tech upgrade when COVID hit. You see, these systems are routinely prone to the very failures they claim to prevent: bureaucratic bottlenecks, political interference, and the kind of mission creep that quietly transforms public health tools into data harvesting machines with almost no transparency or accountability. But the message from the WHO is pretty much unmistakable. These threats justify whatever measures come next. The plan leans heavily on lingering concerns without mentioning the elephant in the room of the novel injections. Instead, the WHO cites long COVID statistics, ongoing circulation, and future uncertainty to rationalize expanding globalist infrastructure and reach. Then comes the heart of the system, CoviNet. It's an international network of reference labs and surveillance programs now extended to 45 national laboratories, cutting across human, animal, and environmental sectors. Framed as a benign upgrade, CoviNet doesn't replace existing surveillance structures. It layers onto them, complementing the already vast global influenza surveillance and response system. It's surveillance feeding surveillance, a net cast wide enough to catch anything even so much as deemed a potential coronavirus signal. We're told this is all part of a consultative and inclusive process, as if input boxes checked on a form translate into actual democratic oversight. The language, of course, is carefully crafted to soothe. It's routine and emergency management. It's flexible. It's context sensitive. Yet every strategic line runs into the same direction: more monitoring, more data integration, more real-time reporting, more international coordination, more authority granted to the very institutions that have lost public trust throughout the last 5 years plus. And that's the crux of the issue. This isn't written like a temporary emergency plan, but more so, as mentioned, the blueprint of a permanent global operating system, one that blurs the line between public health preparedness and ongoing behavioral and biological surveillance. Take Objective 4, for instance, which is essentially a call for ever-expanding data collection under the banner of evidence generation. It stretches far beyond medical research and into broad surveillance of ecological trends, social behavior, mobility patterns, workplace conditions, and even people's health literacy.
Behavioral science is now the first line of defense for our health system.
We have our own applications too that nudges people and reward them for healthy behaviors or giving them badges or these kind of rewards.
The Government of Canada is a strong proponent of behavioural science as part of an interdisciplinary approach to improve the health and well-being of all.
All of this is framed as necessary to understand how coronaviruses emerge and spread. But again, it reads more like an open-ended mandate to study and monitor virtually every aspect of human and environmental activity. On top of that, the plan pushes for ongoing investment in next-generation vaccines, diagnostics, and therapeutics, including products designed to block transmission, something that the earlier COVID-19 vaccines were widely marketed, with the expectation of curbing spread, only for real-world performance to fall far short of that pharma fever dream. This also shows us that the biomedical pipeline underpinning the COVID era isn't slowing down anytime soon, but instead it's being locked in, expanded, and formalized as a permanent pillar of global strategy. Look, I think we can all agree that disease prevention matters, but when every new proposal arrives packaged with sweeping data collection frameworks and top-down guidance that looks suspiciously like governance, people have every right to ask whether the infrastructure being built is truly about health or about control under the guise of health. Because if a global pandemic treaty couldn't be secured in the open, then it seems like this piecemeal technocratic strategic plan may well serve in its place, implemented not by consent, but by creep. For Rebel News, I'm Tamara Ugolini. Expose the WHO is our dedicated website to all things World Health Organization related. If you'd like to support our journalism on this topic and find out more, please do so at exposethewho.com.